Hi doctors, day 8 of Focus 30. So today day 8. Okay. So today I am going to discuss very small but very important topic. Very important topic. And these whatever small topics I am going to discuss today, 2 to 3 questions will come from this topic. This is like 75% chance, or sometimes the same question will come from that area. And you can see what are the important areas I am going to discuss. Sleep disorders. Okay. Now you see here a baby, some night terror. So nowadays those people who are preparing NEET PG, they are in terrors, nightmares. Okay. You can see a baby here. This is ichthyosis classification. Onset, definitely they are asking question. And BNS, we had discussed about the IPC section. Now BNS section, we will discuss very important question, and definitely one question may come from the abortion areas. Okay. And postpartum depression, you can see here Kajal Agarwal. So she had postpartum depression. So postpartum period is very important. And there is one important question, especially they asked in INICT before. Nowadays they are started asking in your NEET PG exam, DNA repair defects. This is like direct questions, not difficult questions. Okay, so these are very small but very important question, and I am expecting 2 to 3 questions from these topics. And surely one question is sure, if you are lucky 2 or 3 questions will come, and this is very important. Okay, now we'll start with the topic. Now we are going to discuss first the sleep disorders. Very important. Individual section of these sleep disorders are prone questions. One question may come. Okay, we will see that. So now we can see here stages of sleep. The sleep cycle, we have N1, N2, N3 and REM. So these are the stages: N1, N2, N3 and REM. So you can see from the diagram, N1 is very small. You can see N1 is very small. N2 is having maximum. So maximum duration is N2. Okay, and N3, which is written as deep sleep. Okay, and REM, you can see the REM phase. So vivid dreaming is written here. So now you can see very important. So REM, which is vivid dreaming, N2, which is maximum. N2 is having maximum, and N1 is having least duration. So a person started sleeping, we will go to N1 stage, N2, N3 and REM, and each stage have some EEG changes. Waves are there, so we have to see the waves. Okay, so now we will see the waves, then we'll come back to this table and we'll discuss. So these are the major waves. Okay, so you can see here normal waking state. So normal waking state, beta waves are there. Okay, normal waking state, beta waves are here. You can see the beta waves. Beta waves are 13 to 30 hertz. Okay, so let it be. And just before sleep, okay, alpha waves. Just before wave, alpha waves. Alpha waves are, you can see, 8 to 13 hertz. Okay, 8 to 13 hertz while relaxed or sleepy time, just before sleep, sleepy time. Okay, clear? And when N1 start, these are known as theta waves. So you can see here there are theta waves. Okay, and stage 3, N3 sleep, you can see something called delta waves. You can see the number of frequencies coming to low, it is coming down. Okay, you can see something called delta waves, you can see here. Okay, clear? And last REM phase mein you can see a wave, both are beta waves. So beta waves are normal waking stage ka waves. So that is seen in REM sleep also. So why? We will see that. Okay, so this is just a brief one. You have to identify the each waves. So how to identify, I will tell. Okay, just listen here. So you can see alpha waves and beta waves are looking similar. Correct only, no? So but beta waves have more frequency. It will be more clumped. Waves are more closer. Okay, frequency is more. N1 and N2, which is having something called K complex in N2. In N2 sleep is having the maximum sleep cycles. Okay, 45%. So there is something called K complexes are seen in N2, and sleep spindles are seen. sleep spindles are seen. Sleep spindles and the K complexes are seen in N2. Okay, and N3, which is the deep sleep, having called delta waves. So we can say N3, which is known as the deep sleep is N3 having delta waves. Okay, so you can see here, delta waves, delta waves, delta waves are in deep sleep, that is N3. Okay, and REM stage is like a normal waking stage. So this is little confusing, but you have to by heart this area. You have to understand also. This is very simple once you understand, but this is confusing. You have to see this, add to your 20th notebook, paste it somewhere. It is very important. Okay. Now you come back here, we will discuss. So we have N1 stage, which is the smallest. Then we have N2, which is the longest, and N3, which is the deep sleep, and REM sleep, which is the vivid dreaming. Okay, we will see. So N1 stage, with here theta waves are seen in EEG. These are known as micro sleep. And here hypnic movements, hypnic jerks are seen. So myoclonic jerks are seen here. You are about to sleep started, some myoclonic jerk. You had experienced before also. Definitely, whenever you are sitting in a chair after your duty or post duty, suddenly you have some myoclonic jerk. So you are started sleep N1 stage. You have some myoclonic jerks. Okay, clear. Now coming to N2 stage, so N1 crossed, you are in N2, which is the longest, and it is a light sleep. Okay, so what happened in N2? We are having something called K complexes, and it is biphasic. Okay, which is like low frequency and high voltage, biphasic K complex, and we have something called burst of alpha rhythms also present, like that. So just understand, we have K complexes and sleep spindles are present. K complexes are nothing but it is biphasic. So I had drawn here K complexes are like this, biphasic. Okay, biphasic, and it is low frequency, high voltage. It is like this, low frequency, high voltage. So voltage is high. You can see voltage is high. Whereas sleep spindles are like an alpha based rhythm, high frequency and low voltage. So voltage is like this. These are sleep spindles. So like this, very high frequency, low voltage, and narrow spindles. This is seen in N2 phase. So N2 have two characteristics. One is K complex and another one is sleep spindles. So we will see here N2 may, you can see the sleep spindles here, and you can see the K complex, which is biphasic and having high voltage, low frequency. Clear? Simple. That is N2. So N1 may we had theta waves. N1 had theta waves. You can see the theta waves. Okay, it is an enlarged version of what we can say alpha wave or whatever, beta wave, alpha wave, like that. So we can see theta waves here. Okay, theta waves here. Okay, clear. Simple. Now we have to go to next phase known as the N3 stage. Okay, in N3 stage is the deep sleep stage. Deep N3 is known as deep. N3 is known as deep delta. You can see deep delta waves are there. So this is the area where even I call you multiple times, get up. You are in deep sleep. Maximum threshold to awake is here, and this is a restorative sleep. This is very important for a person who had a proper quality of sleep. The quality of sleep is determined by the N3 stage. So who are having less N3 stage, their quality of sleep will be disturbed. They have some problems and they are not satisfied. They have some personal problems, or they have like what we can say, it's like the restorative sleep. It is an essential phase of sleep cycle, N3. Okay, clear. So deep delta waves. Now you can see the delta waves here. See how delta waves are there. See delta waves, we can say like this. So you can see like this. So delta waves, which are very low frequency, you can see seen during N3 stage. So this is very important. Only these two cycles are important. Everywhere they can ask question. They can ask maximum duration of stay, this sleep, N2, and the deep sleep, N3. The quality of sleep determined by N3. Okay. Now we are coming to the last phase known as REM phase. REM sleep. So REM sleep may you are seeing something called sawtooth appearance in EEG known as paradoxical sleep. See, you can see here REM sleep ka waves are beta waves, and whenever you are waking state, that is also beta waves. So it's like you are sleeping but you are like waking state. It's like a paradoxical sleep. That's why it is known as paradoxical sleep. Clear. So that's why here you can see the sawtooth appearance looking like beta waves. Clear. So this is very important. Please understand these two slides, this slide and this slide. This is just a summary. This is enough, and from here they can ask question. Every alternate year they are asking one question from this area, and this is in psychiatry. This is in psychiatry. It is there, and it is very important. Okay, clear. Now we are going to see you can see one more here. You can see a normal sleep pattern. A person morning 8 a.m. he is wakeful. In the middle of the night, he is coming light non-REM, deep non-REM and REM sleep. See? Okay. Then around morning 8 o'clock again he came back to wakeful state. This is normal. But this is reversed here. With intermittent sleeping. So person is sleeping in between. So he is wakeful, suddenly going to sleep, come back, again going to sleep, come back, sleep. This is nothing but a narcoleptic sleep pattern. This is known as narcoleptic. So narcolepsy. Okay, we will discuss this also. Okay, disorders of sleep. So this is very important, clear. Now we are going to the next slide. So this is, see what is this? In the middle of the night, you are in deep sleep. Suddenly you got some dream, you got up shivering, and you are not remembering anything. This will happen, and sometime you will remember also. So we will see what are night terrors and nightmares. This is very important. Before that, beta waves in EEG when eyes are open. Alpha waves in EEG are closed eyes or focused attention. Alpha waves are indicative of focused attention or closed eyes. That is important. When eyes are open, it is beta waves. This is very important. Okay, just one point you should know. Now you come to night terrors versus nightmares. Both are examples of parasomnia. Okay. Now we will see what is this. Okay. Now what is night terror? Known as parvus nocturnus. See, it is usually happening in young children's adolescents. When it is happening in the N3 stage of sleep, in the deep sleep, you are sleeping, baby is sleeping or the child is sleeping. Suddenly, once some event, dream happen, just he'll get up with tension, heart tremors, sweating, tachycardia, and he is like confused, but he is not remembering anything. So complete amnesia will happen. So the baby got some dream, but he completely forgotten that. That's amnesia happened. And tachycardia, post-arousal confusion, these are there. This is known as night terrors. Definitely we got terror for that. We are like afraid of that. So that's why it's known as night terrors. Terrific thing. Okay, important. But what is nightmare? So nightmare, nothing but nightmare, M-A-R-E. So R-E-M, remember. So nightmares that are seen at any age during REM sleep, and it is remembered. REM remembered. It is very important. And associated symptoms not seen. So you in the end of the sleep, in the REM phase, you are going to see some dreams like you are become the NEET PG topper. You are dreaming that, and you got up in the dream. You are like, yeah, I saw a dream. I'm become a NEET top ranker. So this is REM. You will remember that. Okay, this is very important. This is happening in the REM phase. That's why you are remembering. Many girls or many people. Even I had dreams in my REM phase. I remember many dreams. Still I am remembering those dreams. Okay, so REM. These are nightmares. So you should understand that was a nightmare, that you will become a topper in NEET PG, but don't make it as nightmares. These nightmares, REM dreams, whatever in our mind, we'll make it hard. We'll work on that. Okay, we'll work on that, put our hard work, and we'll get a whatever our desired rank. Okay, we'll work for that. Okay, so clear. So that's why this is known as nightmares. This is known as night terrors. This is very important. So this is very important related to sleep, and we'll conclude with narcolepsy and the management of insomnia. Narcolepsy already I discussed. It's like a person in daytime sleep attacks. So he's like active, suddenly sleep, again get up, sleep. So you had seen the image here, in the graph here. See, this is known as narcolepsy. So what happens here? This is because of decreased orexin or hypocretin activity. Orexin 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 very important. It's a hormone of wakefulness. Hormone of wakefulness. You will be wakeful when orexin is there. So if it is reduced or hypocretin is reduced, you will be in this daytime sleep attack. This is very important. Okay, and the sleep latency and REM latency decreased. So you'll sleep sometime, get up, sleep sometime, get up, like that. Okay, this is very important. Clear? So SOREM, sleep onset REM occurs, and you have falling asleep and waking up, falling sleep, waking up. This hypnopompic activity will be there. During this narcolepsy, loss of muscle tone in emotional situation and collapse on floor. This is known as cataplexy. Cataplexy happens during narcolepsy. Okay. Catalepsy is seen in catatonia. This is very important. In narcolepsy, cataplexy is happening where our muscle tone is decreased. Okay, collapse on the floor happens. Suddenly we will become weak. This is not catalepsy. Catalepsy is seen in catatonia. That is another psychiatric condition, different condition. Okay. So what are the management of narcolepsy? Modafinil. This is a dopamine reuptake inhibitor. So modafinil increases that sleep cycle proper and reduce the daytime sleep and like that. So dopamine reuptake inhibitor. Okay, modafinil. So the management of narcolepsy is modafinil. Okay, related to dopamine reuptake inhibitor. So cataplexy is here. Daytime sleep attack, decreased to orexin or hypocretin, hypnagogic and hypnopompic activity. These are very important. Okay, and decreased sleep latency and REM latency. This is important in narcolepsy, managed by modafinil, which is a dopamine reuptake inhibitor. DRI, dopamine reuptake inhibitor. Clear? Now we will just see what are the treatment of insomnia. We have benzodiazepines, set glass drug, that is solpidem, saliplone, sopiclone. These three set drugs. Okay, and melatonin, our melatonin agonist. Okay, so like ramelton, tasimelton. So rameltion, tasimeltion, these are important. Okay, and DORAs, this is very important. They can ask nowadays this question directly. What are DORAs? Dual acting orexin receptor antagonist. Orexin, which is a wakefulness hormone, orexin receptor antagonist. So that cause drugs like suvorexin, daridorexin. Okay, this can be asked. So insomnia, so can be managed by DORA Bujika DORA dual acting orexin receptor antagonist. So orexin antagonist, these are orexin receptor antagonist. So suvorexin, daridorexin. So you can see from the name only, rexin. From the name we can identify. Okay. So clear? Orexin. You can see orex, OREX, orexin, and ANT, antagonist. The name is here, there only. So you can see orexin. Okay, orexin. You can see orexin antagonist, orexin. So suvorexin, daridorexin, orexin. It is there in the name only. That is nothing but DORA, dual acting orexin receptor antagonist. This can be a potential question for the NEET exam because this is very important. Set glass drugs, solpidem, saliplone, sopiclone. These are important. Okay, and benzodiazepines that can be used. Clonazepam is most commonly used, most effective. Okay, clear? And melatonin, M1 M2 agonist, we can see rameltion, tasimeltion. Okay, this is also important. So treatment of insomnia, narcolepsy, and the night terror and nightmares and the sleep cycle and the waves, these are very important. Clear? Okay, now we are going to discuss something called BNS. Okay, BNS, we have discussed before IPC in the fourth video in detail. Okay, so IPC they may not ask because it is replaced by BNS, which is the updated one, but you should know that IPC. That's why I kept IPC first. We have to learn the old one first. Now we are going to the new one. So then we will compare. So here IPCs are whatever we discussed in the fourth video, it is there. Please go and watch if you want. And BNS, in that only we can compare this BNS. Okay. Now I am going to discuss some negligent acts and BNS. Okay. So when next 2 to 3 slides is containing so many numbers. Okay. So many numbers. Okay. These numbers are very important, and there are many potential questions from this area, and you should know that also as a medical student, as a forensic PG or a forensic student, you have to know that. Okay. So medical legal aspects many are there, we have to know these some sections, very important. Okay. So many people can take forensic medicine as PG. This is very important, you should know the, and you are practicing, you should know this, and you are a citizen of India, you should know something basic things. So now we'll see the negligent acts. First we can see 271, you can see 271, you can see 271 and 272. 271, negligent act likely to spread the fatal infection. If a person is HIV positive and he spread this infection to another person without knowing, without a malignant act, he don't know he was HIV positive, he had shared some needles or did some intercourse, and the HIV spread happened. This fatal infection like HIV happened. This is comes under 271. And if he already know he was HIV positive and he is spreading it, that is known as malignant intentional act, comes under 272. These are very important. You can expect a question from this also. This is very important, that's why. Okay, clear. Now we will see some other. So we can see 100, we will call 100 police. Definition of a culpable homicide. So these 100 and 101 are definitions of homicide. Any homicide, culpable homicide amounting to murder and not amounting to murder. So those culpable homicide amounting to murder or not amounting to murder, like provocation, self-defense, public servant, all these things without premeditation. So all these things are coming under 100 and 101. So definition of culpable homicide 100, and the culpable homicide amounting to murder, not amounting to murder, coming on 100 and 101. This is very important. Okay, they can ask this question. Okay, they can ask this question. That is 100, 101 related to the amounting to murder, not amounting to murder. So culpable homicide. Okay, now we are come and see, and the punishment, the offense and punishment. 103(1) is murder, and 103(2) mob killing, more than 5 people. Imagine more than 5 people killing one person, hitting and killing one person. So that is coming on 103(2). 103(1) murder. Okay, so imagine single person killing single one is murder in 103, and 103(2) is like mob is killing more than one, more than multiple, more than 5 members killing a person. Mob killing is 5, like that. So more than 5 people, mob killing, 103(2). And 106 and 108. 108 is like, yeah, ambulance number. So abatement of suicide. 106, death due to medical negligence of RMB. See, death due to medical negligence. This is very important for us. 106, death due to medical negligence. 106, this is very important for us. Okay, this is very important for us. And 108, abatement of suicide. This is also important. So 103 1 and 2 is like murder and mob killing. 106, medical negligence and death due to medical negligence. Clear, important. So this is very important. HIV spread through two without knowing, with knowing. 271 and 72. 100 and 101 culpable homicide definition, and this one. And here murder, mob killing, and 106 medical negligence. They can ask this directly. Okay, 108 is abatement of suicide. Important. Now we are going to discuss something about grievous hurt. So grievous hurt and hurt. So anybody causing any bodily pain, disease, or infirmity to a person, it is coming under 114. So 114, 114, 115, 116. These are definitions. You can see 116, definition of grievous hurt. Grievous hurt definition. So all hurts are not grievous hurt. Grievous hurt is like there is a significant problem because of that hurt to the person. For example, any bone fracture, loss of eyesight, hearing loss, So somebody smashed here, attacked here with some wooden rod something. So he lost his uh, hearing ability. That is comes as grievous hurt. Okay. So grievous hurt, you can see emasculation, permanent privation of sight or either eye, permanent privation of hearing problem, sight problem, any joint fracture, permanent impairing of power of a member or joint problem, and you can see that disfigurement of face and fracture or dislocation of bone. So these are coming under grievous hurt, and this is explained in 116. Very very important. 114 and 115 are definition. You can see 115 is voluntarily causing hurt. Causing hurt is intentionally attacking him. And 114, anybody causing bodily pain, disease or infirmity to any person is said to cause hurt. So that is 114, this definition. Especially 116 is very important. They can ask this. Okay, they can ask this. Now we'll see the punishment of this. 117, 118, 123, 125, 125, 124. So what is this? This is also very important. Expect a question from this. Okay, this is very important. Please write it. 117. You can see 117. Okay, 117. Voluntarily causing grievous hurt. So grievous hurt was 116. So voluntarily causing grievous hurt, GH is 117. 118, 1 and 2 are there. 118, 1 and 2 are. 1181 is voluntarily causing hurt with dangerous weapons, dangerous weapon, knife. Okay, 1181. 1182, voluntarily causing grievous hurt with dangerous weapon. So the 1181 may they are getting hurt, but it is not grievous hurt. Grievous hurt is 1182. 2 important. Okay, clear. So now 123, hurt by means of poison. So you are hurting a person with poison, you are poisoning a person. That is 123 important. And 125, so rash or negligent act endangering life. That is 125. 125 1, negligent act become hurt, it is 125 1. Negligent act become grievous hurt, it is 125 2. So this is a negligent act which is causing a hurt, which is a hurt, it is 125 1, which is a grievous hurt, it is 125 2. Clear? And the important and highly important 124, acid attack, vitriolage, very very important. Okay, very very important. 124, acid attack, attempt to acid attack, coming under vitriolage, which is 124. This is also important. So this is very important area. PNS, people are asking from BNS. Okay, so examiners are asking from BNS, not IPC, but you should know a little IPCs also, and especially 124, 123, 116, 117. These are very important, and you can see here 100 and 103 definition are also important. Now we will see potentially 5-star question. Definitely it's a 5-star question. Miscarriage, criminal abortion done against MTP rules. This is very important. You should know that. So we have 88, 89, 90, 91, 92. So 88. In Malayalam we can say this is a 8inde pani, but ഇത് 8inde pani, 28. So 88. So it's like very very dangerous. So 88 is criminal abortion with consent of woman. So criminal abortion with consent of woman is 88. And what is 89? So criminal abortion without consent of the woman, it is 89. And what is 90? 90 is resulting with death of woman. So you done a criminal abortion, that is 88. With consent, without consent, 89. And that abortion leads to death of the woman, it is 90. Very very important. 90. So 90 is very very important. And you can see 91. So act done with intent to prevent live birth or to cause fetus death after birth. So this act made to prevent live birth or cause fetus death after birth. So fetus death is happening here is 91. And 92, causing death of quick unborn child by act amounting to culpable homicide. So these two are also very important. And 91 and 92. 91, this is act done with intent to prevent live birth. They have to prevent the live birth or to cause the fetus the death after the birth, they have to kill the fetus or they have to prevent the live birth. So this is coming under 91. In India, whether it is male or female, we in the USG we can identify whether it is male or female. This gender identification during this pregnancy time, it is very wrong. So but in many areas in India, people are doing gender identifications and informing, and they are doing criminal abortion. This is happening, and many females are dying. That is 90 is happening. Okay, so that is very very bad. You know, those people with two girls, they went for again pregnancy baby. They are doing some doctors are doing this illegally, and they are doing feticide, female feticide. This is so bad, so bad. Okay, so this is very very important. Okay, these sections are very important. That's why this can be come as a potential question for our exam. Now we'll go to some very very important another topic and direct question, and you should know the topic. If you know the topic, you will get the 4 mark. If you don't know the topic, you will lose your 5 mark. Now we'll see nothing but ichthyosis. Why ichthyosis? So we are discussed before also. Ichthyosis, fish like scaly skins. Okay, so ichthyosis, there are 3 main types, and I'll be discussing in detail about ichthyosis and the potential question. So Ichthyosis vulgaris and X-linked ichthyosis or Ichthyosis nigra, XR, X-linked recessive. And one more thing is our lamellar ichthyosis. Okay, so what is Ichthyosis vulgaris? This is due to a filaggrin defect. What because of that, the fine wide scales are formed. So you should know the anatomy, dermatology basics, what is filaggrin, what is acantholysis, what is acanthocytes, you should know what is desmoglein. So this is very basic. If you want to discuss in detail, it's like a big class, but you should know this is filaggrin defect and fine wide scales are formed here. So you can see Ichthyosis vulgaris here. So fish like skins are there, you can see here. And X-linked ichthyosis, you can see something here. So this is a steroid sulfatase defect, and brown black scales are there. You can see here. Okay, and associated with corneal opacities and cryptorchidism. This is also very important. And lamellar ichthyosis, nothing but this is due to epidermal transglutaminase defect. Okay, epidermal transglutaminase defect. Okay, so here parchment like colloidal membrane in the neonat. You can see a parchment like a colloid. So you can have parchment colloidal membrane. You can see here. See here, parchment like colloidal membranes are present. Okay, so these are associated with the ectropion and eclabium and ectropion. These are associated with this also. So this is very important. Lamellar ichthyosis, which is important. X-linked ichthyosis is also important. So now the question will come direct like this, or they can ask according to the onset of the ichthyosis. Now we are going to see what is the total number of ichthyosis classification and the onset. So you can see Ichthyosis vulgaris. Usually you can see 2 months and beyond. So it's like more than 2 months. May start with 2 months, 2.5 months, 3 months, 5 months, 1 year. So it is like that. So very important. Now X-linked ichthyosis. So 17% at birth and 83% at first year. So majority in the first year and very minority 17, around 20% in the birth. So that is X-linked ichthyosis. And X-linked ichthyosis diagram, you can see brown black scales are there and associated with the cryptorchidism and corneal opacities. That is also important. And the next main important is we have something called keratinopathic ichthyosis. So it is also from birth with the superficial blistering will be there. And our lamellar ichthyosis, it is birth. So from birth there is a colloidal baby will be there from birth. So lamellar ichthyosis from birth. Ichthyosis vulgaris 2 months and above, and X-linked recessive, it will be present from the birth or later. In the first year it will be the highest, around 80%. In the birth it is 17 to 20%. Clear? This is also very important. So this is enough from this box. In detail it is there. Okay, these are the classification of ichthyosis and ichthyosis diagram and what are the defects. Ichthyosis vulgaris is filaggrin and X-linked is steroid sulfatase, and lamellar ichthyosis, epidermal transglutaminase defect. You should know all these 3 points. Please watch, see this video again and again. Okay, clear. Even though it's looking small topic, this potential question will decide your rank. Okay, okay. Now we are going to see postpartum period. No, see, Kajal Agarwal is there, our favorite actress. She had postpartum depression. So we had seen the news. So any woman who's carrying for 9 months and delivering, there are so much hormones in the body. Suddenly, because of delivery, all the hormones will come down suddenly. It will cause some emotional problem, some depressions, some psychotic problem to the woman. So this is known as postpartum period diseases. So what are the diseases? We'll see. So what is the postpartum period? Duration of following delivery. This postpartum period disorders, in ICD it is written as 6 weeks, and in DSM it is written as 4 weeks. Okay, 4 weeks. So we will see what are the postpartum diseases related psychiatric conditions. Okay, the first one is known as postpartum blues. Postpartum blues. Postpartum blues. Postpartum psychosis and postpartum depression. So here mainly you should know the onset. Okay, okay. Now what is postpartum blues? Within 2 to 3 days and resolved within 2 weeks. A woman, she was very good. She was carrying at 9 months. She delivered immediately within 2 to 3 days. She developed this postpartum blues. Okay, some problem, behavior problems, and it is resolved within 2 weeks. Okay, so this incidence is almost 50%. Out of two, one pregnant woman after delivery, she experienced this postpartum blues. Okay, this is benign and self-limiting, no complication. It is safe, nothing to worry in this. Okay, clear. But what is postpartum psychosis? Around 2 weeks after delivery, around 2 weeks. This is very important. Around 2 weeks after delivery, this is happening, and here acting out thoughts of harming baby, acting out, and it is abrupt, and it is seen in 0.1 percentage, 0.1 percentage. 0.1 percentage, you can see 0.1%. So it's abrupt, and there is very thought of harming baby. So this is a 2 weeks, around 2 weeks after delivery, this is happening. Okay, and postpartum depression around 2 to 4 weeks after delivery, and symptoms of depression can be seen, and seen in 5 to 15% people, pregnancy cases. So what happens here? So there are timelines are emerged. This is postpartum blue is starting 2 to 3 days, and it is resolved in 2 weeks. And postpartum psychosis around 2 weeks, and postpartum depression around 2 to 4 weeks. Okay, and here in postpartum psychosis, harming baby, thought of harming baby, and is abrupt and acting out. Some features are present. Okay, some features are present. So this is also very important, and you should know management of pregnancy. The lady who carries baby for 9 months, immediately after delivery, all her relatives, husband, father, her mother, father, they are going to the product. They are not seeing the manufacturer. The mother will be in the bed with their pains. Their bones are broken in that delivery pain. They have severe problems, hormonal problems. But baby, everybody is happy with baby. They will take care of baby. They won't give attention to the mother. So these things will contribute along with the hormonal factors. So that is also very important in postpartum period. The act of suicide, act of depression. So this is very bad. So we have to support the mother and baby. You have to see the manufacturer and the product. Okay, both are important. This manufacturer can produce multiple products. Okay, so you should understand the manufacturer is very important. You have to take care of them. Baby, anyway, the manufacturer will their breast milk, and baby will survive, not a problem. You have to take care of the mother first and the baby too. Okay, this is also very important. Okay, okay. Now we are going to what I'm telling this. Recently my wife delivered, and I have a baby 4 months. So we had been in this situation, and I had supported my wife the maximum possible way. Okay, so we have to support them. That's why she is like in a good state. We have to support the mother and the baby too. I had done both. Okay, it is very very much needed. Now we'll discuss about some little complicated but very important topic known as DNA repair defects. DNA repair defects. Okay, so DNA repair defects, which is very important. Okay, because these are INACT topic, but they are now asking in the NEET directly they are asking. Okay, 1 minute. So before seeing this box, we will go and see the next slide. See, you can see here. So there is some damaging agents. This slide is not that clear, but I am just telling in the brief way. These damaging agents like UV light, X-rays, or any replication error. So X-rays, replication error, UV lights, this will cause some DNA damage. You can see some DNA damage is happening here. So what happened? This DNA damage is happened. So we have to repair the DNA. So for repairing the DNA, we have different repairing mechanisms. One is base excision repair, nucleotide excision repair, recombinational repair, and mismatch repair. So repairs are different type. So this damaging agent cause some error in the DNA. This DNA got damaged, and there are some DNA repairing mechanism that will repair the DNA and make it whether apoptosis, cell cycle arrest, survival, or cancer causing, whatever. So sometimes it will repair and it goes survival and the DNA will come back. Sometimes it will damage the DNA, breakdown, apoptosis, the cell is dead, gone. Sometimes cell cycle arrest will happen, there is no further growth. So this damage caused by some mutations or mutagens or X-rays, whatever the agents, DNA damage, DNA repair. If the DNA repair mechanism not happened, that cause some diseases. These diseases are known as DNA repairing defects. So these DNA repairings are, we will see what are the DNA repairings. We will see. Now we'll come back to this. So the repair, you can first you look at here. Just look at here. Repair mechanisms. Okay. Repair mechanism. We have NHEG, non-homologous end joining. Non-homologous end joining. Homologous recombination. Nucleotide excision repair. Base excision repair. Mismatch repair. These are all repair mechanism. If any problem in this repair mechanism, it will cause some diseases. That diseases we will see. So now you come back again here. So DNA damaging agent, DNA damage is happened at DNA. Now repair pathway. These are the repair pathway. BER, base excision, nucleotide excision. This is a recombinational repair and mismatch repair. What we are discussed here. This repair. So they have any problem that cause some diseases. Now we will see that disease. Before that, you can see here NHEG, homologous recombination. See, you can see homologous recombination. If you want, you can see refer here also. This is non-homologous. See, you can see it's non-homologous. This is homologous. Okay, and you can see this is transition coupled NER, nucleotide, and so these are all very important. So this is the basic summary. Now you come back and you see here. See, because of this non-homologous end joining repair mechanism, which is not happening, it will cause SCID. SCID, severe combined immunodeficiency syndrome. Okay, SCID. So NHEJ SCID. This is important. And any problem with homologous HR, it cause Bloom syndrome. HR Bloom. Okay, HR Bloom. We'll see the mnemonic in the last. And last, nucleotide, NER, nucleotide excision repair. Any problem in this repair mechanism is causes xeroderma pigmentosum. So xeroderma pigmentosum, blisters in the sun exposed areas, skin cancers risk are there. Xeroderma pigmentosum. And base, BER, base excision repair. It is associated with the polyposis, MUTYH associated polyposis. And mismatch repair is associated with the Lynch syndrome or hereditary non-polyposis colorectal cancer known as HNPCC. MMR, mismatch repair with HNPCC. Okay, clear? So this is a little difficult to by heart, but you have to know this. This is also very important. Direct questions will come from here, and making a mnemonic, it is little difficult, but we'll keep a simple mnemonic. At least we have to eliminate some option. So SCID, So SID is by NHEJ. Okay, non-homologous end joining repair mechanism defect causing SCID. Clear. So what I remember, NHEJ have 4 letter and SCID have 4 letter. Okay, so I will remember like NS4, normal saline 4 or NS4, which is in hepatitis C and all, NS4. So NS, so NHEJ 4 letter, SCID 4 letter. This is severe combined immunodeficiency, very important one. And now you can see HR Bloom syndrome. So homologous recombination, HR Bloom. So I think like our HR, any company there is an HR in the room, and HR room. So HR room, HR means homologous recombination. HR in our room Bloom, like that I thought, used to remember, but something we can make. Last one more mnemonic will come. And NER and BER is there. NER. So next NER, NER X. So I'll remember like next. So nucleoside excision repair, NER X, xeroderma pigmentosum. Okay, and BER. So BER, I won't tell you to study because one polyposis. And MMR, which is important, it is causing limb syndrome. Okay, this is also important. Even if you are making any easy mnemonics, please send me. I didn't study this topic in detail before. I know this topic by NHEJ 4 letter SCID. SCID we studied in 1990. Adenosine deaminase definition we studied before. And HR in room is headache, Bloom. It's everything Bloom. I thought like that. And next NER X, xeroderma pigmentosum, sun exposed. I remember like that. And other two may mismatch repair, Lynch syndrome, HNPCC, colorectal cancer, like that I remembered. So now you come here. There is a deep DNA repaired mnemonic is there. HB facts. But it's what I cannot tell you in detail. HNPCC, colorectal cancer, Lynch defect, this is mismatch repair. They are telling just what are the examples. In Viva, whenever you are doing in your UG, it is helpful, or PG it is useful. But combining these two diseases, it is very difficult. B4 Bloom syndrome, helicase defect leads to genomic instability. Nothing is there. F4 Fanconi anemia, A4 ataxia telangiectasia. Here it is ataxia telangiectasia like disorders are seen in HR. Okay, and we are studying with mainly Bloom syndrome. There is Werner syndrome also. Okay, so this is little confusing area. At least you study this. Okay, NHEJ, NS4, NR4. This kid have 4. HR in the room, Bloom, and NER next, xeroderma pigmentosum, mismatch repair, HNPCC, and Lynch syndrome, like that you study. Okay, this is very important. So this is little confusing topic, but this is an advanced question. Directly this question will come. You have to answer this. If you answer this, surely 4 points in your pocket, and 50% of the people make this wrong. Sure. I'm damn sure 50%, and more people, I think more people will make it wrong. So if you know this, you will get a good 4 mark. Okay, and postpartum period, these are very important, especially the onsets are very important, and the management, I didn't tell about management. The SSRI of choice is sertraline, and there is some drugs like SSRIs to be avoided is fluoxetine and paroxetine, and brexanolone, breast is like breastfeeding. Brexanolone is specific for postpartum depression. Okay, that is also important. Brexanolone, breast means breastfeeding, postpartum phase. So this is specific for postpartum depression. Okay, these are ichthyosis ka onset. This is very important. Ichthyosis directly they will ask, POTUS will be there. Don't go fall in trap. They will see the options also, read the option properly. BNS very important, especially this criminal abortion. This slide is very important, you have to know. And this hurt grievous are also important, and this punishment and definition also very important. And now you should know everything about all sleep disorders and everything. Almost everything I covered in a simple way. If I wanted to take in depth, no, I can take in detail, but that is not needed. Just see this, watch this video again and understand. So today we are discussed very important, and I am expecting a 2 to 3 question from this topic. And these topics daily I am updating in around 10:30. Sometimes it is 11 o'clock because of my tight schedule. And this is just, we are reached 8 day out of 30. Still 22 days are there. We have to put so many topics. People are asking previous year topics and all. And now I am going to make a separate video for medicine and important PYTs. I'll explain, and like that I'll planning to put small subject cluster of 7 subject, their important topics, community medicine important topics. So at least you go and watch these topics, it is easy. And I'm planning one more thing in medicine. I will discuss cardiology in 1 hour, neurology in 1.5 hour, RS in 1 hour. Like that I'll take a class which is very crisp and very much important PYTs, and management I'll discuss. So like that I'm planning for that also. If anybody wanted, please comment in this video ka comment box mein. Anybody wanted medicine ka classes, please comment. And because of time problem, I am not unable to put so much time, so that is why. And this Sunday Monday I'll be putting two videos, because there are 2 videos pending. So that also I'll try to cover in this period. Any topics you want to discuss, personally message me or comment in this one. So Focus Thetica Day 8 is ending here. Please watch this video and share to your friends, and watch the previous video, revise that videos also, very important. And I'll try my best to help all NEET PG aspirant in my own way. And thank you. Please watch this and update me and put comments, and let me know what I want to do further. Thank you so much.